Thanks so much, John. I appreciate that introduction. That's very nice. I had to smile when Maria mentioned that she was jealous of Alberta's strategy, because I now have layers of jealousy with both Alberta's tremendous movement forward to integrate with their health services, and also BC and the work that they're doing, all the tremendous supports that they're creating for people who live with pain. So we're a number of years behind both of them, but moving forward for sure. So I'm excited to have the opportunity to share some of the work that we're doing here. So let me just pull up my slides here. All right, so hopefully you can see those. So I'm going to, here's my disclosures. I hold a number of research grants, and do want to acknowledge that I live and work on Treaty 6 territory, which is traditional lands of First Nations and Métis people. So I'm going to start off just giving a little bit of the Saskatchewan context, just to put into reference kind of who we are and the context in which we're trying to grow SaskPain activities. And then I'll just share some of the work that's been happening over just the past year. So for those of you who aren't familiar with SaskPain, we were incorporated as a nonprofit in May of 2018. So we are a baby pain society, and really proud of the work that we've done over the last couple of years, and especially this last year. It really feels like the momentum is moving forward quite a bit. So to start off with, Saskatchewan is right in the middle of the Canadian prairies. We're a little bit to the right of Alberta, where this conference is being hosted. On that map, we are the yellow province, the rectangular one. Hard to spell, easy to draw is the joke. We have a population of about 1.2 million people. Half of our population lives in two urban centers, Saskatoon, which is where I live, and Regina. About 20% of our population lives in smaller cities, between 10 and 50,000 people, but about a third of our population lives in rural and remote communities, distributed all across our province. 16% of our province reports an Indigenous ancestry, largely several First Nations, as well as Métis people. And then about 15% of our population is over the age of 65. Back in December of 2017, our 12 different health regions across the province amalgamated into a single health authority. So we're very new into that, and still feeling a little bit of the growing pains associated with that, but it offers some opportunity for collaboration for sure, and for coordination of services for pain management. Back last summer, we conducted an online survey of primary care providers, physicians, and nurse practitioners related to chronic pain, and found that there were about a third of visits to family doctors and nurse practitioners were related to chronic pain in some way, either pain as a primary condition or a secondary condition. And our primary care providers also reported that they felt that they were practicing in silos, that they didn't know who to refer to in their communities who had expertise in chronic pain management. And they also reported that the patients that they were working with often faced financial barriers that impacted their ability to really take advantage of that multidisciplinary approach to care. The patients couldn't afford to go to a private fee-for-service physical therapist or chiropractor or acupuncture. And also about half of the participants in our study reported that they were familiar or very familiar with the 2017 Canadian opioid guidelines. So a little bit concerning about kind of that inability to practice in a way that reflects best practice. Also in Saskatchewan, we don't have a lot of specialty services for pain management. We have some. We now have 2 adult multidisciplinary clinics and a pediatric interprofessional pain clinic. The 2 adult ones are fairly new. The pediatric one has been around for at least a decade. None of these have dedicated funding, operational funding from our health services. They're largely funded through SUOP grants through the federal government, and mainly focused, at least the 2 adult ones, are focused on opioid deprescribing, but they also support pain management as part of their care. We have a number of interventional clinics that are largely anesthesiology led. We do have some self-management courses, so offered through our health services. Live Well with Chronic Pain is an in-person class, and the online therapy user pain course, which is research developed by Dr. Heather Hadjistravelopoulos, which is an online cognitive behavioral therapy program. Unfortunately, there's not a tremendous amount of awareness of the public or of our healthcare providers around these services. So quite often I'll get emails of people asking what we offer for pain management because people aren't aware that these services exist. So to summarize the Saskatchewan context, we are a very diverse and geographically dispersed population. We don't have many specialty health services for pain management, which places, of course, not just in Saskatchewan, it places the burden of care on primary care providers, who in our province report that they work in silos of practice with low awareness of existing services. So that provides an opportunity for SaskPain to step into that gap and bring people together to support development of communities of practice, to raise awareness of existing services and support different ways of that people can manage pain, as well as research and education. So I'm going to share some of the work that we've been doing over the last year with SaskPain and the projects that we've been involved with. So the first thing I wanted to mention is our 𝐒𝐂𝐂𝐑𝐈𝐁𝐄 collaboration, and we have worked with the College of Physicians and Surgeons, who sourced some funding for us to operate an Project 𝐒𝐂 for chronic pain. And it's been mentioned a few times before, but essentially this is an online learning approach, a hub and spoke model, where we have a brief didactic lecture, topical lecture provided by an expert on a topic. And that's followed up by 1 to 2 case presentations and discussions. And these are cases, real cases that are presented by healthcare providers who are calling in, and we have discussion about the cases, and people are offered next step solutions for working with the patient to help improve pain outcomes. So we are now on our 3rd series of this. We've been going since January 2019. And we've had 19 2-hour sessions. We've discussed 34 complex cases. These have ended up in an average of 6 recommendations provided per case. And we've had an average attendance of about 45 people at each of our sessions. And just at our last one a week ago from Wednesday, we had 59 people attend. So we're excited that it seems to be growing with each series that we do. And people report very positively of their learning. They feel comfortable asking questions, and they score high on our evaluation of their intent to change practice. So we're quite happy with how things have been going with 𝐒𝐂. We're also very proud of our website redesign. For those of you who may have visited our website in the past, it was hard to navigate and not very visually appealing. So we're very happy with our new website. So please check it out, saskpain.ca. On this, we have information for people living with pain on the services that are available. We have information for healthcare providers on courses and training programs, not just in Saskatchewan, but around the world. And then we list and give a bit of a profile of some of the research that's happening in Saskatchewan. And we have quite a range of really interesting research that's going on in the province. Plus, we let people know about news that's happening outside of the province. So we did advertise this conference on our website. And we invite people to get involved and share their stories about pain as well. One of the more recent activities that we've been doing with SaskPain is collaborating on a research project, which is part of our research team are board members of SaskPain. So we were fortunate enough to receive some funding from the Saskatchewan Health Research Foundation and the Saskatchewan Centre for Patient-Oriented Research. And what we're doing is really looking at the contextual impacts on pain management. So it's a community-based participatory action research project in 3 communities. And Rob mentioned before how context, communities, you can't just rubber stamp an idea and put it in another community. So we're really looking at quite a granular focus within these communities. So we're looking at just Saskatoon's downtown core neighborhoods, Yorkton, which is a smaller community, and also Regina around their pediatric children living with chronic pain. So we're thrilled. Our research team is just an absolutely phenomenal group. We have 3 patient family advisors on our team, and they are intricately involved. They helped with designing the research project, and really it focused on what they wanted to get out of the research. But not just that, they're helping us recruit participants. They are collecting data and conducting interviews. Even the graphic design that's shown on the side was the work of Erin Beckwell, one of our patient family advisors. We have a number of healthcare providers, and very exciting is we're very highly engaged and actually have health network decision makers on our research team as well. So we're really thrilled with this. We're just in our first phase of this research where we're conducting interviews, and we're probably about 10% into these interviews. And our next phase will be co-designing pain services in these 3 communities, and then implementing and evaluating those. So we're really excited and hope to see some great changes over the next couple of years of research funding with this project. And the final project that I wanted to talk about is something that SaskPain was involved with. A number of other groups or speakers have mentioned CADith. So CADith is the Canadian Agency for Drugs and Technology in Health, and they are a federally and provincially funded organization that conducts evidence summaries for decision makers. So CADith and the Saskatchewan Health Authority collaborated to conduct 20 evidence summaries on non-drug approaches to managing chronic pain. And from this, my role with the Saskatchewan Health Authority, we developed 3 information packages for people who live with pain on physical, psychological, and preventative strategies for pain management, and they summarize the evidence. We created a poster that you can see there on the right in blue, and we also created 3 information packages for healthcare providers, again, on the physical, psychological, and preventative approaches to non-drug pain management. And the clinician materials go into a little bit more depth on the evidence, and they also provide practical tips for working with someone who lives with chronic pain, and for example, how to support exercise or how to support a person living with pain to access acupuncture. So these are available cadith.ca/chronic pain. And SaskPain's role in this was having focus groups with people who live with chronic pain. And we recruited some people from our email distribution list who took part in these focus groups. And their input really quite drastically changed the wording, the language, even the icons were changed. The poster was completely changed, all because of the input from the people who live with pain. So it was really a tremendous co-design activity working with people who live with pain. And you'll see on the patient information materials that some of our people with lived experience have provided quotes for those as well. So we're really happy with those, and we're starting to get the word out about those, but please take a look at the webpage and check out those materials. So I just want to acknowledge our fantastic board of directors, and these are all volunteers who are doing this work. We don't have any paid staff on SaskPain, so that would certainly be a wonderful thing if we could have the funding to support paid staff that could help really grow our activities. But this is just, this group is such an amazing group that really is quite enthusiastic and pours their heart and soul into the activities of improving pain in our province. And that is, those are my contact details and information on how you can contact SaskPain. And I look forward to hearing your questions at the end.